In a therapy workshop entitled Am I a Lesbian?, Anna struggled with trying to press her piece of clay into shape, saying afterwards, "I realise how much I've tried to do this with my sexuality." Seeing the marks that the clay had left on the paper beneath it, she had drawn into them, excited at the idea that similarly her sexuality could, in her words, emerge or happen, without having to be pushed into a definite shape. Sandra swept crayon marks into a curving crest, which she said was like an orgasm. Next to it, a small field of scarlet poppies had appeared. She said she was amazed at the intensity of their colour, yet they were contained in such a small space. She felt they expressed for her the joy I have had to deprive myself of for so long. An area of crayoning, merging and fluid, was a solid part, the possibility of meeting another woman sexually. She tentatively wondered how she would be able to manage the double stigmatisation of being lesbian and being black, and the shame I might feel. Belinda's tiny clay figure, curved over in the yoga position, pose of a child, hid her face from an angry mother. To be intimate with a man or a woman will never be possible while I'm so fearful of my mother, she admitted. Lucy's black and purple scribbles surrounding a glowing red patch, encircled by a protective line, are my sadness and confusion. There have been too many relationships with men that have disappointed me, yet I'm terrified of being with a woman. These examples are of course disguised to preserve the women's confidentiality. All of them had come to a one-day workshop in the hope of finding certainty of knowing if they were really lesbian or not. Through their artwork, they discovered an embodying language for their ambiguity and uncertainty, and through describing their imagery, they found new words, new speech. They were able to begin to acknowledge the importance of the individuality of their own socio-culturally specific sexualities, and to consider how they might find the courage to assert these. There was discussion as to the relation between these and different possible identities. For example, being lesbian, being black, being bisexual, being a woman, being a mother, or having a work or professional identity. In Alienation and Perversions, Masood Khan describes a woman's experience of sex with another woman. She now recounted how she liked licking the grooves around the neck of her friend. It always gave her an uncanny feeling of her friend's wholeness and smoothness. The impulse to eat and bite was only thinly veiled here. The fight with the oral sadistic and the anal sadistic impulses now came to the fore. He claims that the tongue was fantasized as the castrated genital. It had a restitutive role both in relation to the object and the self-body ego. Insofar as it symbolized the penis, it made good to her partner what she'd been deprived of in being taken away from her male lover, father. From the few words of this woman regarding her pleasure with her partner, Khan doesn't produce any other further associations from her in her own speech. Khan produces the truth about her same-sex sexuality. It is a defense against destructive impulses. It restores, in fantasy, a fragmented body ego and also the destroyed object. And it's an attempt to heal the loss of the father's penis. For Khan, there can be no sex without a penis somewhere. The contrast between the language of this psychoanalyst, his patient has denied her own language, and the language of the women in the workshop, both visual and spoken, jolts us. How far can we transform psychoanalytic theorizing and practices in a way that can address the uniqueness and diversity of sexualities? Theories of sexuality such as Khan's, Socarides, Glasser's, Segal's and Limontanis continue to be taught on psychoanalytic trainings. The Oedipus complex is still assumed to be universal, albeit of differing importance depending on the particular theory of child development. Although in this paper I'm addressing the limitations of classical psychoanalytic theorizing of sexuality, I want to emphasize that my critique doesn't undermine for me the importance of its radical aspects, its recognition of the limits of rationality in human subjectivity, its engagement with those aspects of our experiences of which we're unconscious. and its acknowledgement of the importance of our histories. These perspectives underpin the concepts of transference, countertransference, identification, and of defences such as projection, splitting, resistance, and displacement, all of which, together with many others, I find useful in understanding the texture of my clients' worlds, including their relationship with me. Although my clinical work is predominantly with individual clients and couples in verbal analytical psychotherapy, I draw on my experience of the women's exploration in the workshop Am I a Lesbian, as it crystallises so vividly how diverse languages of sexuality are. My responses to these women's languages of tactile and visual imagery, of gestures and words, concern the women's particular experiences of embodiment, the specific relations between their experiences of joy, fear, playfulness, loss and excitement, the reasons or purpose for their confusion, the connection between this and the socio-historical and cultural expectations of certainty in relation to sexual identity and orientation, the manifestation of their experiences as sometimes simultaneous, sometimes split, sometimes shifting, the relation between their present and their past, and also their experimentation with future possibilities of their sexualities. Instead of assuming a split between body and mind, I wondered about the source of experiences of such a division. In my questions, I am along with psychoanalysis influenced by the work of the philosophers Merleau-Ponty, 1907 to 1961, a phenomenologist, and Foucault, 1926 to 1984, the black psychoanalyst Frantz Fanon, 1925 to 1961, who is strongly influenced by phenomenology, and the writing of the black lesbian feminist novelist and poet Audre Lorde, who died in the late 1980s. All of them emphasize the importance of language and embodiment, which I think are particularly relevant to psychoanalytic psychotherapy practice, sensitive to the needs of sexual minority clients, as well as every other client. A phenomenological perspective attends to descriptions of human experience rather than explanations of experience in terms of causes, as in Kant. It emphasizes the temporality of subjectivity and the meaning of experience, arguing that we can never possess a complete understanding of our own origins, since from birth we are thrown into an already constituted world of language, of family constellations and our culture. Disclosure of existence always depends on the context, which is intersubjective and linguistic. For Heidegger, it is our intonation, modulation, tempo and the way of speaking which is most crucial. Language is between people. Merleau-Ponty writes specifically on sexuality, arguing that mind and body, subject and object, are not distinct and separate entities, and language is therefore itself a form of gesture. The spoken word is a gesture and its meaning a world. For Merleau-Ponty, sexuality is coextensive with life. It's therefore historically and culturally specific. While acknowledging Freud's contribution in showing that sexuality is what enables the subject to have a history, he makes an impassioned challenge against Freud's naturalism. Merleau-Ponty's theorizing contains the seeds of queer theory, if we understand by this an anti-essentialist view of sexuality, which emphasizes the context through which sexualities arise. Sexuality, for Merleau-Ponty, is ambiguous. Neither conscious nor unconscious, it spreads forth like an odor or a sound. It is diffused with images, such that the dreamer's penis becomes the serpent which appears in the manifest content. He problematizes notions of the unconscious as a container, a discrete inner world, completely distinct from consciousness, and argues that instead it is coextensive with life. This informs his challenge to the assumption that behaviour associated with, for example, anger or love is the same in Eastern and Western cultures. Moreover, he argues the difference of behaviour corresponds to a difference in the emotions themselves. What might such a notion of the unconscious mean for psychoanalytic psychotherapeutic practices? Sandra's small field of bright poppies had appeared spontaneously, revealing what she had not been conscious of, namely how intense and yet how constrained her longing for intimacy with another woman was. Her sexuality was, at that moment, a small field of scarlet poppies. At another moment it had had the power of an ocean wave. The ambiguity and complexity of these images cannot be adequately understood through notions of alinguistic impulses and sexual repression. As she spoke, less conscious associations in relation to the expansiveness of a wave and the small size of a field emerged. These referred to her experience of the social context of black and white cultures which deem same-sex sexuality abnormal and unacceptable. Her mother's view of any overt sexuality in women as cheap and dirty, and her fears of, in her words, standing out like a strange creature, as black and lesbian. It seemed too that in confining her red poppies, Sandra was also protecting herself. The force of the wave had felt liberating but also shocking to her. Sandra's work in the group highlights the restrictions of a notion of the unconscious, theorised as being entirely split from consciousness and the wider social context. I think the conscious and unconscious are thus useful adjectively but not as nouns. This is important for the developing of a practice that can allow for differences, whether in terms of gender, sexuality, race, class, disability, and the multiplicity of others in their socio-historical and cultural specificity. Frantz Fanon, writing in 1952, analyses how black person's identity comes into being through the white other within a context of power relationships in which she or he is, in his words, woven out of 1,000 details, anecdotes, stories, and designated as inferior. He vividly describes the bodily effects of being objectified in the face of a white child's fear of him as a black person, so that my body was given back to me, sprawled out, distorted, recoloured, clad in mourning on that white winter day. The earth rasps under my feet, and there is a white song. All this whiteness that burns me. In response to the racism of the white other, he decides to assert himself as a black man, to counter the irrationality of white racism. Refusing to conform to white culture, he begins to identify with sensuality, with nature, with rhythm and spontaneity. Yet he finds himself again stereotyped as primitive. Fanon draws on psychoanalytic theory in his analysis of racist assumptions that black people are more sexually potent than white people, and argues that these are projections of their own desires. He also challenges the universality of Oedipus complex, finding it to be absent in 90% of families in the French Antilles. As an anti-essentialist, he emphasises the differences between black people, challenging the notion of a black psychology. He views his own task as freeing himself from his history, including that of slavery, from the dualisms of inferiority and superiority, to touch the other, feel the other, to explain the other to myself, and above all, to never cease questioning. Fanon's account resonates with Merleau-Ponty's account of embodiment as cultural, but he goes further in including an analysis of the effects of racism. His theorising of the role of power in the emergence of different black identities converges somewhat with Foucault's regarding sexuality, yet predates his by nearly 25 years. For Foucault, although Fanon wouldn't go as far as this, there's no body prior to history or to discourses. The body is totally imprinted and moreover produced by historical forces. He argues, as Fanon does in relation to race, that power is transmitted through discourses and practices relating to sexuality, producing culturally specific identities, including those arising as forms of resistance to a dominant discourse. As I've argued in my paper, Who Speaks, Who Listens, Different Voices and Different Sexualities, this is exemplified in the differences between the same-sex sexuality of two upper-class married white women, such as Virginia Woolf and Vita Sackville West in the 1920s, and that of a black working-class woman identifying as queer contemporaneously. Merleau-Ponty's, Fanon's and Foucault's theorising share an emphasis on the socio-historical specificity of embodied experiences and of sexual identities. This hinges on a view of language, whether verbal, gestural or visual, as creating worlds rather than explaining an already existing world. Within the psychoanalytic relationship, possibilities are opened out through language. These are meaningful between the client and the therapist, but they are also contingent truths or perspectives which hold at a particular moment in time and which can shift over time to be replaced by new stories from fresh angles. For the psychotherapist listening to a client talking about sexuality, the question should not, in my view, be what is this individual's sexuality or sexual identity, nor what is the cause of it, but in what language or how are these being described? How intertwined or how distinct are they from the person's other identities or experiences? What are the particular conscious and unconscious meanings of them for this particular person in this particular context, including the effects on them of homophobia, racism, sexism, and so on? How might all of these be at play in the transference? How far, if at all, are any of my own identifications with any of these identities useful? These questions are not concerned with universals. They're concerned with addressing the uniqueness of each individual's experiences. The question of differences in the contingency of identities, how they shift and how they are interwoven, is central to Audre Lorde's novel Zami. Written in 1982, Zami is a very rich account of a young black woman's life, beginning with her childhood in Harlem in the 1930s and extending through the 1950s and the McCarthy era. The language of Lorde is vividly visual, tactile and sensual. She's acutely sensitive to the socio-historical and cultural, including the linguistic contexts of her characters, and her accounts of women making love with one another are, as the women's paintings I described, a strong challenge to classical psychoanalytic accounts. Lorde never idealises the notion of identity. As a black lesbian, she's very aware of the political necessity for identities, and at the same time questions how these can also allow for individual differences. I would like to end with her words, as I think they're very relevant to therapists working with sexual minority clients and all other clients. For some of us, there was no one particular place, and we grabbed whatever we could from wherever we found space, comfort, quiet, a smile, non-judgment. Being women together was not enough, we were different. Being gay girls together was not enough, we were different. Being black together was not enough, we were different. Being black dykes together was not enough, we were different. Each of us had our own needs and pursuits and many different alliances. Self-preservation warned some of us that we couldn't afford to settle for one easy definition, one narrow individuation of self. It was a while before we came to realise that our place was the very house of difference rather than the security of any one particular difference, and often we were cowards in our learning. It was years before we learned to use the strength that daily surviving can bring. Years before we learned that fear does not have to incapacitate, and that we could appreciate each other on terms not necessarily our own.
Mary Lynne, I was struck by you talking about this workshop, this anti-lesbian workshop. When people are struggling to come to terms with being gay, being a lesbian, and there are cases still where people feel very isolated in some of their thoughts, fantasies and feelings to do with homosexuality. If you're seeing people on an individual basis, there's just the two of you, and the history of about coming out, the gay movement, has always been one of coming out but coming together as well. And I just wonder, really, is there a clinical problem for the analyst who's faced with someone, whether the analyst is heterosexual or homosexual, is faced with someone struggling with this, that it's not enough, that the situation with the therapist, the once a week, twice a week, is not enough in struggling with these questions, and that getting together with other people, workshops and so on, might be something that might be recommended or hinted at if the person's not ready for that.
Yes, I think that's true. I mean, first of all, I think in terms of the value of what goes on in individual therapy, that how you acknowledge the isolation, the huge courage that it takes to come out, and the struggles with that, and how it might touch on so many other experiences of very difficult feelings about oneself and other feelings of shame. Those are things that can be very, very usefully explored within individual therapy, providing the therapist is attentive to the effects of homophobia, and that's the context within which we will live. I think certainly, just to go back to the individual therapy again, but of course there are lots of experiences that people find isolating and would benefit from being in wider groups, and I think the aim of therapy in a way is allowing people the possibility to gain the strength to go into wider contexts where they might be able to explore those as well. But what happens in the therapy relationship resonates with the rest of our lives. So in that sense, I think that through therapy, through change, people will move more easily into other relational contexts in all sorts of ways. But I also feel there's no harm in saying to somebody, well, maybe it would be useful to go to a workshop, because I think there is a huge power of being in a group with people who are struggling with very similar things, and the level of anxiety and confusion and terror is enormous, and I think there's a huge amount to be said for all of the different support groups that have been set up within the lesbian and gay movement, the Women's Therapy Centre, in all sorts of settings, but for people who collectively really value and gain a lot from struggling with those issues.
Bernard.
Can I say something about the role of group therapy then?
Yes.
As a kind of another form of therapy, which Bernard Ratty talking about group therapy rather than the dominant model of individual therapy, and how often I found improperly led group therapy, where the heterosexual patients actually can be enormous agents of change for homosexual patients, and when helping the would-be gay patients or the confused gay patients in a way which they're not paid to do anything with the other patients, they're not paid to help the other patients, and I think that can be a very powerful method of helping people not just to come out but to confuse, but to work out their internalized homophobia. It also helps the heterosexual members of the group, rather than as another form of help, not just a kind of a support group.
Yes.
A therapy group. Thank you.
No, I think that's true in relation to negotiating lots of differences in a group, but you're right, it depends absolutely on the therapist. Because about 20 years ago I was in a kind of therapy training group, and I'd just ended a relationship with a partner, and I was I think I mentioned this breakup about twice over about 12 weeks, and somebody in the group said to me, "Why do you keep mentioning this?" Which was, what would have been very helpful was if the group therapist had immediately interpreted, well, what's this question about, really? She hasn't kept
I did
mentioning.
emphasise the problem.
No, I'm just recognising that you said from the perspective of the group therapist. But otherwise, I agree with you. I mean, I think, a diversity within any group setting can be incredibly helpful for people and allow people to feel stronger in negotiating the heterosexual world too. Actually live within the group setting.
I once remember reading a book on group analysis and said it's helpful to have at least one flamboyant homosexual in a group. I won't say anymore.
We've got time just for one more comment or question. Anybody? At the back, Laurie? Okay, your hand up was just up before. Sorry.
It's just a gloss really on the point we were talking about before, the art thing, and what I remembered was when I was in my teens, I fancied myself as a bit of an artist, and I had an aunt who was a very good painter, and I said to her, do you think I should use some of my savings to get myself some proper, be taught properly how to do this? And she said, the one thing you mustn't do is just go to an artist and ask that artist to teach you how to paint. Go to a group. She said, it's absolutely essential that you see how the teacher says something and everybody in the group will respond to it differently. And she said you'll actually discover something much more important for yourself there. And it seems to me that's a sort of parallel to what you're talking about. And what I've only just realized today, and it's a sort of interesting thing of how it helps sometimes just to have a space to reflect on these things, is that the class I went to was a life drawing class at St Martin's, and it was actually the first time in my life I'd had the chance to see a nude woman or a nude man, and actually to gaze on the unadorned body, and in a sense begin exploring my own sense of what was right for me in relation to what I was seeing, while seeing how differently everybody else responded to it. So thank you, you've actually helped me to make a very important connection.
I think the thing about artwork is that the differences are so striking and so distinctive, and I think that we're much less attentive to the poetry of verbal languages and the specificity of how each of us speak, and whether in terms of modulation, tempo, gestures, as well as the actual words. And I think that is terribly important in psychoanalysis, that we're really attending to what's absolutely particular to that person and not try and translate it into the language of breasts, drives, and so on.
Thank you. Yes, we will be coming back to all of the speakers at the end of the day, and I really want us to keep to time. I'm ever so sorry about this, but we've got half an hour for each thing. Otherwise, everything else will run late. So please make a note of it and come back to Mary Lynne at the end of the day about it.